Hey everybody, this is Jared Lyons. I'm a veterinarian who specializes in cancer in Florida. A lot of times I have a question about vaccinations in cats, and there is specifically one type of tumor that we know has a strong correlation between, historically at least, giving a vaccine and then growing a tumor in that location later on. Now, there's been many different steps by companies to try to minimize this risk, and they've done a great job so far at doing that. However, there still are some cases, unfortunately, in cats specifically, that can get what's called a vaccine-associated soft tissue sarcoma. Therefore, the recommendation if you are giving your cat a vaccine is to do it really on the tip of the tail, or ask your veterinarian or the person who is vaccinating the cat, or do it on a leg. But the leg recommendation really is important that you don't do it right by the hip. You would have your veterinarian do it closest to the toes as possible. That way, God forbid, we do get a tumor in that location, at least surgically, there's something that we can do to get pretty good margins on these tumors. Vaccine-associated sarcomas, unfortunately, they have little tendrils of cells that are pretty far-reaching, and therefore, a lot of times, even if you remove the mass itself, you still have the roots of the tumor left over. Therefore, if you do vaccinate your cat, definitely have your veterinarian vaccinate as far away from the body as possible, so the tip of the tail or even the leg. Now, the incidence of this is very low. There's old statistic to say it's 1 in 100,000 animals this can happen to, or 1 in 10,000 animals. So the need for vaccines is very important. I do think that it's something that should be done. Let's just do it in a way that we minimize risks at a later date. All the best.